Side of the semimembranosus, another muscle is there. This muscle, this is called semitendinosus. This muscle flap is called semitendinosus. This entire one is semimembranosus. This entire one. This is adductor. This one is adductor. This muscle to this muscle thickness is the semimembranosus. Then below that, this one is the semitendinosus. Now you see, one part of semitendinosus at its insertion point is going towards tibia, but another part is contributing towards the formation of this Achilles tendon. This part you can say is going towards the formation of the, contributing towards the formation of the Achilles tendon. The muscle which is visible here is actually the medial head of gastrocnemius. This is the medial head of gastrocnemius. This one. Now coming to the leg region muscles. First we will see the lateral aspect muscles. Most of them are extensor muscles. Now if I describe the leg region muscles from anterior to posterior, I can see the first muscle is this one is the large muscle band, that is the complex muscle. Now why it is called complex? It can be visible from its distal end because it is constituting three tendons. This is one large tendon, you see it is coming from the complex muscle. This large tendon is actually the tendon of muscle of peroneus tertius. This is the peroneus tertius. Now by the side of it, the tendon, this is the tendon of medial distal extensor. This is the tendon of medial distal extensor. This is the tendon of larger one is the peroneus tertius. This is the tendon of medial distal extensor, and this is the tendon of sidewise is the common distal extensor. So I can hold with my finger the three different tendons. This is the tendon of peroneus tertius. This is the tendon of medial distal extensor, and this is the tendon of common distal extensor. You can see if you track and going towards the proximal end, all these three are coming from the same muscle. So this is called complex muscle, and sometimes it is also referred to as pregnant muscle, because if I give a cut here, I can see the inner muscles, that is the medial distal extensor and common distal extensor. So this together it is called complex muscle. Then if I lift the complex muscle, you can see if I lift the complex muscle, I can see another muscle band. You see this is the muscle one. Now the origin of this muscle is actually from the tibial tuberosity and tibial crest. This is the tibial tuberosity and this is the tibial crest. The origin of this muscle. Now the name of this muscle is this one. The name of this muscle is tibialis anticus or cranial tibial. This one, tibialis anticus or cranial tibial. And this muscle can only be seen, after lifting this complex muscle. After lifting this complex muscle, only this muscle can be seen. Now by the side of this muscle, another muscle is there. This is called peroneus longus. This was peroneus tertius, and this one is peroneus longus. In between the peroneus longus and peroneus tertius, one nerve passes. So in between the peroneus longus and you can say peroneus tertius, which is a part of the complex muscle, one nerve passes, and this nerve is the peroneal nerve. This is the, you can see the peroneal nerve, it passes. Now by the side of the peroneus longus muscle, this one is the lateral distal extensor. This thickened muscle is the lateral digital extensor muscle. So again this one is the lateral head of gastrocnemius. This is nothing but the tendon of biceps femoris, which is coming from the hip and thigh region. This is the hip and thigh region completely. This is the biceps femoris, Now you see the insertion point of the biceps femoris. This one is the actually the tendon of the biceps femoris, which is contributing towards the formation of this Achilles tendon. Now, an important point to remember, in between the lateral distal extensor, this one is the lateral distal extensor and this one is the lateral head of the gastrocnemius. In between them, you can find one small muscle, this one, this small, if I remove the gap between them, so this small muscle is actually the soleus. This is the soleus. But the thing to remember, soleus, you can see distally it is merging with the lateral head of gastrocnemius. This soleus is merging with the lateral head of gastrocnemius, and I can say it is indirectly contributing towards the formation of the Achilles tendon. Though not directly, but indirectly it is contributing towards the formation of the tendo-Achilles or Achilles tendon. Now, if I see the anterior aspect of the pes region, this one, anterior aspect of the pes region, you can find a muscle strip here. You can see this muscle. This is the extensor brevis. In the forelimb, in the manus region, there was no muscles, but in hind limb, a single muscle is there in the at the anterior aspect of the pes region. You can say this side and also from this side. So this total muscle is called extensor brevis. Medial aspect. We have seen medial aspect of the leg. We have seen this is the medial head of gastrocnemius. This one is nothing but the semitendinosus. Now, if you see the medial aspect, this is the medial head of gastrocnemius, this is semitendinosus. This is the medial head of gastrocnemius, and this is the Achilles tendon or tendo-Achilles. Now, this is the, you can say this is the gracilis, this is semimembranosus, this is you can say tendinosus. So if I reflect the semitendinosus portion at the insertion point, now you can see this is the popliteus, this triangular muscle. This triangular muscle is the popliteus, this one. But for that we have to reflect the insertion part of the semitendinosus so that we can see the popliteus. As it is, it cannot be seen. We have to reflect the insertion portion. Now, once it comes to the deep digital flexor muscle, just like forelimb, it also has three heads. So the three heads are, the first one is this one. This one. This is called as the, you can say the medial head. This is the medial head. This one is the superficial head. This one is the superficial head. This one is the medial head. And this one, this is the medial head. This one is the superficial head, and this one is the deep head, which is the largest one. So all the tendons of these three muscles, they unite and to form a single tendon of the deep distal flexor muscle. It is quite peculiar in its position because it is again one of the muscle which is contributing towards the formation of the Achilles tendon, and the location is special because it is present in between the two parts of the gastrocnemius, or you can say two heads of the gastrocnemius muscle. So if I can lift the medial head of gastrocnemius, you can see if I lift this is the medial head of gastrocnemius. If I lift the medial head of gastrocnemius, I can see one muscle. This one is the SDF, that is superficial distal flexor. And in another side, there is presence of lateral head of gastrocnemius. So SDF is present in between the two heads of the gastrocnemius. And finally, I can say the tendo-Achilles is contributed by the tendon of so many important muscles. The bulk actually is contributed by, you can say, medial head of gastrocnemius, lateral head of gastrocnemius, tendon of biceps femoris, tendon of, you can see, semitendinosus, this one, tendon of semitendinosus, it is contributing here. Then tendon of SDF, and finally the tendon of the small muscle, that is the soleus. All these muscles are contributing towards the formation of tendoachilles or Achilles tendon, which is inserting onto the fibular tarsal bone, that is tuberculosis or point of hook of the fibular tarsal bone.